Welcome to season 4 of TuneIn. This is our second episode where we are spotlighting World Diabetes Day, a cause that touches millions around the globe. Joining us is someone truly special, Dr. Mitul Thakker, Chief Medical Officer at IKS Cares Foundation. It's such a pleasure to have you with us, Dr. Mitul. Welcome to the show.
Thank you, Dipti, for inviting me to the show.
Great. So we can begin?
Absolutely, Dipti.
Yes. So my first question to you, Dr. Mathul, is can you tell us a bit about the IKS Cares Foundation and its mission, particularly in the context of diabetes awareness and care?
Right, Dipti. So the IKS Cares Foundation was set up almost 2 years back with a pointed focus on addressing anemia and diabetes in the society. Anemia and diabetes, it is well known that both these problems continue to be large as far as the Indian context is concerned. Let's talk more about diabetes, given this session is going to be about diabetes. It's not new for people to know that India continues to be the diabetic capital of the world, but we need to peel the onion a little more to understand more about why it continues to be such a growing problem versus just continue to say we are the world's capital as far as diabetes is concerned. I think it's important to know that as on today, more than 50% of India's diabetic population actually resides in the rural areas. Right, that's the area that the IKS Cares Foundation is targeting. It is also important to note that this number has grown at least 4 times in the last 20 years. So it's growing significantly. So the presence of rural diabetes is a huge problem that India continues to deal with. We also need to understand that once you have a diabetic patient in the family, it will take away at least 15 to 20% of your limited income to even manage these diabetic patients, right? So at the same time, while there is a lot of talk about diabetes, it is not met with enough in terms of doing something about it. In spite of all the efforts being made, not more than 30% people have access to the right diagnostics and right treatment as far as diabetes is concerned. Not many people are even aware. More than 60% patients are not even aware that they are diabetes. So I think the problem is a multidimensional problem, right from awareness to availability of diagnostics to treatment, and then keep following up on diabetes. I think all of these continue to be a problem. And that's the reason we have a large focus on trying to manage diabetes.
Great. I think this is a fantastic work, Dr. Mitul, both in terms of anemia and diabetes. And I'm sure our doctors at IKS Health are so proud and enjoying their work in the clinical field. Let's move on to the next question. What are some of the biggest misconceptions people still have about diabetes?
It's a question, Dipti, and very relevant. Misconceptions about diabetes are widespread and often deeply rooted in their cultural beliefs. There is limited health literacy amongst this population. And of course, there is, as I said before, consistent access to care is completely missing. Let's understand, I think the misconceptions are across various categories, right from understanding the disease itself, right? The commonest belief is it is not a poor man's disease, it's a rich man's disease. I think that's one of the biggest misconceptions that continues to prevail. So it's not just about rich people that will get this disease. Two, people think that it's a sugar problem. Once you stop eating sugar, the problem is gone. So that's not, again, that's not true at all. It requires far more better understanding of the disease itself. The third thing is people think once you start medication, you have to be on medications for life, which is not completely true. And there needs to be much more education of how you could prevent or treat or then stop taking medication for a period of time. Saying if I eat local medicines or local remedies, that's more than enough. So people go back. Traditional India goes back to a lot of medicines to treat themselves through local people who are not qualified to help treat diabetes, and that continues to be an ongoing problem. Again, people feel that supplements like jaggery will not impact your sugar levels, right? Take away sugar, replace the jaggery is another misconception. And I'm giving you simple examples one can relate to, because it's important we start talking people's language here. People think if I'm thin, I will not have diabetes, right? So again, that's another misconception. Going back to insulin, people feel insulin is for people who are fatally ill. If I am on insulin, that means I'm really ill. So again, misconception around some of the medication there. Again, these are some broad categories under which you could bucket misconceptions of diabetes.
Yes, and I think IKS Cares Foundation is doing more than enough to raise awareness and get rid of these misconceptions in the rural areas. Moving on to the next question, as a CMO, how do you approach building campaigns that inspire real behavior change and not just awareness?
Yeah, again, an excellent question, Dipti, especially for India's context, where diabetes awareness is improving, but behavior change remains the real challenge. I think that continues to be a challenge. I think a great question. It's not easy to go and just say, stop having sugar or stop eating stuff with sugar. Why don't we go back and give people examples? Say, hey, why don't you replace your biscuits with your with your chapati or your roti, and use similar examples where we need to actually tell them what to do versus what not to do. What are the real things you can replace foods which are high in sugar content or are highly glycemic in nature? I think it is better addressed through involving local community. If you involve your local ASHA workers, your local panchayat, your local teachers, I think uh, whoever you need to involve, we should, as long as there's some trust factor between the people who are going to listen to the final messaging, we should actually work with those communities to educate them. So then they start become the amplifiers of the message that we want to take down to the society. It makes big. I think that's a huge thing that we have also started adopting as IKS Cares Foundation to ensure we are working with them versus directly going to the people, because for them we are outsiders, we are strangers, and our ability to influence them directly is much lesser as compared to some of the local people. Converting them to bite-sized campaigns, or start relating small results. I mean, after you do a campaign, can you find out if people started using less sugar? Has that one spoon of sugar being, are they using less sugar, for example? Have people started taking a 10-minute walk after meals, right? And how do you start creating activities or campaigns around these smaller bits, which will help us measure effectiveness of the messaging? The most important thing that we realize is we have to back it up with real work, right? It's not enough to go and say, do XYZ and get your sugar in place. I think it's important for us to give them access to be able to measure the sugar levels. As I was saying, less than 30% of people have access to actually to real diagnostic facilities. So what we are doing is actually going to the field with our doctors and measuring sugar levels of a lot of these people. And we don't stop there, because knowing that you have a problem is actually not enough. You need to be able to address the problem. So we not only diagnose diabetes, we also treat diabetes. We also provide medications to these people for them to enable their treatment. There are a lot of continuous communication campaigns that we would do over those 3 months to ensure people are A, taking the medication, B, making the dietary changes, C, find out ways to measure some of these changes we spoke about, and then go back and measure the sugar once again. So, and make that as a habit, because we have to make these things repetitive in nature.
Yes, great. I think with awareness, it's treatment and medication and the follow-up camps that IKS Foundation is doing. Dr. Mitul, our last question for today is, how can listeners get involved or support our initiatives?
Yes, I think anybody who can help is welcome. I think we are looking for partners who are there in the field, who have much better access to some of these populations as compared to what IKS Cares Foundation has. So we welcome all those people who may or may not be involved in healthcare as their initiative. For example, we are working with people whose their organization's core objectives around sports, or their objective around working this population of water conservation. And these are just a couple of random examples, but anybody who has access to these people, we'll welcome them to become their healthcare partners. I think they want to reach out to us. We will be happy to become their healthcare partners, whether it is managing anemia in those populations, or managing diabetes in those populations, or even becoming the larger primary healthcare partners over a period of time. I think we would welcome that. If there are people who know other people who can give us access to those people, if you know people, a group of ASHA workers who needs help, if you know other NGOs who can rally with us or partner with us, I think we will welcome all of those people to reach out to us, and we will ensure that we are creating avenues to partner with them and reach out to these societies.
Great, great. Thank you, Dr. Mitul, for an insightful session for this World Diabetes Day. I think awareness, treatment, medication is more than enough. Follow up with doctors is important, and reverse diabetes is possible. So, yes, thank you for the insightful session, Dr. Mitul. Audience, stay tuned. We'll get back soon to you with the next episode. Thank
Thank
you.
you, Dilip.